Welcome back. Today we're talking about cervical cancer, and we were lucky enough to have a cancer survivor, cervical cancer survivor, Pamela Survivor, who has shared her story with us about how she just by chance went for testing and found out that she had the disease and got all the way to a treatment level, which is one of the lucky stories because this is a disease that is said to be a silent killer. Not many people actually realize it until it is too late for treatment. And joining us just to give us the medical perspective of this conversation is Dr. Catherine Nyongesa, who's an oncologist. And welcome to the show.
Thank you so much.
I'd like you to speak to the fact that the symptoms of this disease are usually quite, you don't even notice them. And if you don't go for checkups, you might just wind up having it for a very long time and not being able to treat it just because you did not go for treatment. So please tell me about that.
So, yeah, cervical cancer is actually a big public health problem in our country. And some of the symptoms really mimic other infections.
Right.
And even just like a woman, you may have a discharge. It's normal for women to have a discharge. But when this discharge becomes persistent, sometimes it's false smelling, it's good to have a checkup.
Right.
Other things women present with include pain on intercourse, spotting in between periods, or even after intercourse, you find you have spots of blood, having heavy periods more than usual, and sometimes you can bleed in between periods. Like you had your periods, every 28 days your period come, but this time you have every 2 weeks or sometimes every 1 week. That should cause concern to you. Having said that, even fibroids, for example, can present with bleeding and pain. Having endometriosis and just period changes in a woman's cycle can cause that, and infections. So it's good when you go to the doctor to rule out the infections. It could be that you have cervical cancer.
Right, but then all these things are things that need treatment. But then is it a question of self-diagnosis and going to get over-the-counter treatments for some infections that is making it a big problem? Because if you're having endometriosis or fibroids, then you really need to get to a doctor. So why is it that people don't get to a point of ruling out those infections early enough?
That's why, during this Cervical Cancer Awareness Week, we want to create even more awareness that people actually just go for checkup. Don't wait for symptoms. Most of the time when you have symptoms, it is too late.
Too late, yeah.
And for example, if you are a sexually active woman, go for screening.
Yes.
In the age group of 30 and above, it is good to have an active test.
Yes.
If you're HIV positive, we may start screening you much earlier. And this continues up to about 50 years. And then the doctor will decide whether you really need more regular screening. And once you have the first test, you'll have 5 years of rest if it is negative before you go for the next screening test.
Right, and she's told me about the test that she had to go through, and there was a pap smear. The other one I can't even call biopsy. And then the biopsy. Biopsy is when you take a bit of a cell to go for testing. So these tests are usually seen as intrusive by a lot of people. So could you help settle down people's fears about the intrusion that they don't want to go through, because it's more important and even more, it's cheaper to get the test rather than to get treatment for cancer as a disease?
Yeah, I mean, the big message is that cancer is treatable when diagnosed early.
Yes.
And that's why the importance of screening. You'll be surprised that cervical cancer is one of the cancers that can be prevented just by going for screening, early detection. We can actually pick a pre-cancerous lesion before it becomes cancerous and treat it. And it will be far much cheaper. It will save women lives. And actually, this translates into having a healthy nation.
Yes.
Cancer is one of the leading causes of death in our women, among all the cancers, being number 2 after breast cancer. So women should not fear. And as I said, this is a test you don't do like every year. It is once, maybe in 5 years. So you go to the doctor, they will assess your situation. Are you a high-risk person? Are you at risk of getting cervical cancer? Are you not? what test do you need? One of them is HPV test,
Right.
which is non-invasive.
Okay.
You can actually do it as a self-test.
Okay.
You don't have to go to the doctor. You go pick the equipment, the tools, you swab yourself into the private parts, put it in a container and drop it at the clinic. They will test and tell you, do you have HPV or not? Yeah,
That is one. Then
that is
there's
one
the
of them.
pap smear.
Now the other one is villi, where they put either acetone or Lugol's iodine. These are just some liquids. They swab your cervix to see how it is. Are there any changes? Does it suggest probably you could be having precancerous lesions or not? And then if from there is when now we go to pap smear, which is now slightly more invasive. The doctor has to put a speculum and swab and get some space sample to take to the lab to analyze. Then if it's suspicious, then they have to go now more to a biopsy. What she went through, the colposcopy and biopsy. Now that one is done by the gynecologist.
Okay.
Yeah.
It's a more advanced test.
It's more advanced test.
There are 4 types of tests, and before you get to the pap smear and the biopsies, you have 2 other options that are not quite as invasive. This is what you're saying. Now let's talk about the prevalence of cervical cancer. Is there a way for, okay, why is the age group, first of all, more vulnerable? The one you've talked about, 30 and above, vulnerable to cervical cancer than other age groups?
Okay, in our situation, cervical cancer is caused by the HPV virus.
Yes.
Actually, 99.7% of all the cervical cancer cases.
Right.
Apart from the HPV, there are other cofactors that make one get the cancer. For example, co-infections with some co-infections, multiple sexual partners, which means you keep on getting reinfected by the very high risk viruses. Early onset of intercourse. So what happens is that once you get the virus, it stays in your body for some time.
Okay.
Fortunately, 80% of the women will get rid of this virus by the age of 30. Yeah. So only a few have naturally, because we have some inborn immunity that fights off these viruses. A small percentage have persistent HPV infection that can embed into the cervix and turn it cancerous. But fortunately, still our bodies are able to fight. And a small percentage, maybe due to high risk factors or inability to fight off the virus, progress to cancer. So if this thing can even be picked before it becomes cancer, it is even better.
It's treated.
And it takes many years from the time of infection with HPV to getting cancer. It takes about 10 to 20 and even 30 years and beyond.
So we have plenty of time.
We have plenty of time to go for screening.
Right.
Yeah, and to detect if you have the high risk type.
So Pamela told us about her treatment option, which was a hysterectomy. What are the other options depending on the stages as we conclude the conversation? So
before it becomes, if it's precancerous, you can have a hysterectomy, which is a bit more invasive, or you just have what is called a cone biopsy. They just remove part of the cervix that has the diseased part. But as it progresses to stage 1, stage 2, you'll have the hysterectomy she had. And if it is beyond stage 2, the doctor may advise that maybe hysterectomy is not the best way to go. You may have to undergo radiation and chemotherapy, which is more advanced. So the earlier, the better. Actually, with early diagnosis, the treatment is very minimal, less invasive. But with the late diagnosis, then you deal with the complications. In fact, most women are dying because of complications of the cancer, like kidney failure, anemia, they bleed, they lose blood. Their immunity is weak, they get infections. So such kind of things, and the cancer can also spread to other parts of the body, like the liver, the lung, the brain. So those are the main complications of the cancer. So that is why it's important, like this week, the Beyond Zero is running a safari clinic where people can go be screened. Apart from cancer, we know the leading cause of death in our country are cardiovascular diseases.
Okay.
So high blood pressure, diabetes, you'll get free screening.
Yes.
This is followed, there's also infections. So you can walk in, get screened for infections, and even get treated for common ailments that can be managed at that level. And then get screened for cervical cancer, breast cancer, and get education even about prostate cancer, colon cancer, just the common cancers. And one is free to ask for any information about their health, and this is absolutely free. It will be from today until Friday at Uhuru Park.
At Uhuru Park, where she actually got her diagnosis, which is quite a positive show of how important it is to engage. If you can't afford it, these are free services, so go out and get yourself tested. So you're good now?
Very much okay.
Yes.
I've done 2 biopsies and I've been declared cancer-free.
Cancer-free, wonderful. And that concludes the interview. And perhaps you can add anything else that you'd like people to know as I invite Michael to finish up this show.
I think she has given a good example that being diagnosed with cancer is not a death sentence. Right. And as women, let's take even our children who are 10 years old for immunization against this HPV virus. At KNH, it's free. Clinic number 66. If you have a 10-year-old, take your child. And also let's take care of our sexual lifestyles, because these are the ones which are putting us at risk of cervical cancer.
So there is testing, there are the vaccinations, there is treatment even after you're diagnosed. So there's no reason for you not to be able to fight this deadly disease. Mike?
Yes, I think one of the biggest barriers that we have for cancer, early cancer diagnosis and treatment is cost. So hopefully something can be done to ensure that it is somewhat affordable, because I'm sure many women would shy, many people, not just women, would shy away from getting tested just when you imagine the cost, of treatment and diagnosis. But thank you very much for joining us. Thank you for sharing your story. And I'm sure somebody has been encouraged to even just go out there and be checked, and knowing that having cancer is not a death sentence. That's something that still needs to be preached to some extent. Well, this is where we wind up the show. Thank you very much for joining us this morning. And right here, what we say is that it's a wrap. And this is where we wrap it up. Thank you so much for watching Morning Express this morning. My name is Michael Gitonga. I wish